The basis of the company has always been light-based measurements. That's what we do.
It's here at Nonin Medical's production facility where you could say heroes come to work.
We build pulse oximeters, which are used to diagnose and manage patients that have respiratory issues.
The team is made up of attentive workers who spend hours assembling important life-changing medical devices, including pulse oximetry.
Healthcare providers are very interested in looking at pulse oximetry to determine, does that patient need supplemental oxygen?
Nonin Medical CEO Dave Hemink says the company invented the first fingertip pulse oximeter 34 years ago, eventually becoming one of the most needed tools in the fight against COVID-19. This is a fingertip pulse oximeter, and how this works is the tool attaches to your fingers and it reads your pulse rate and how much oxygen is in your system. My oxygen level says 99%, which Hemink says is in the healthy range.
With COVID, we see sometimes those patients will drift lower. They'll drift below 90, and in some cases they drift way down into the 60s, 70s, and as low as 50s.
Because COVID-19 attacks the lungs, it can cause lower oxygen levels in the body. That's why reading oxygen saturation is so critical.
The last count, we are just under 1 million units that were created and manufactured right here in Plymouth, Minnesota. So an unprecedented response, but we were growing exponentially during COVID and we continue to grow.
Recently, the company was named Best in Business for Health Products.
We really are the leader in pulse oximetry. To be able to be engaged with patients and with caregivers and help, that's a really great honor.
Hemink says the battle against COVID-19 doesn't stop here, hinting that they're working every day on what's next.
People are going to be looking at respiratory health very differently.
In Plymouth, Pafu Yang, CCX News.
Find more local news stories at ccxmedia.org and follow us on social media.